As 2021 draws to a close, everyone wants to know what 2022 would look like when it comes to COVID-19. I'm Nivedita Mukherjee. I spoke to Dr. Amita Gupta of Johns Hopkins Institute to find an answer to that question. I began by asking Dr. Gupta how the COVID dashboard and the Worldometer became a household name.
It's an amazing story because it literally started from engineers who were originally from China and a young professor who wanted to track what was happening in Wuhan. And they came together to sort of use news reports, whatever data was available emerging from the early days of the pandemic, and wanted to sort of monitor where it was spreading. And so from those early days, using all sorts of ways to look at data and integrate data, very sort of exciting new platforms to take all sorts of types of data, natural language processing, scraping the internet for information and collating it, and then really making data visualization simple is how Johns Hopkins COVID dashboard became a household name. It's very exciting for us because we're sort of known in the health space, and I think this really put us in the households of many people across the world.
On the subject of data, how do you compare India with rest of the world, the developed world, so to say? How has India done during the pandemic?
Well, I think there have been certainly some fantastic developments that have happened in India in terms of using data to analyze where, for example, the COVID incidence is happening, where are the hot zones, where are priority areas for delivery of whether it be oxygen or other supply chain needs for health, as well as assessing impacts for supply chain for all other aspects of society. I think like with any scenario, what it has also revealed is that a lot of systems were weak, particularly in the public health space. With the kind of infrastructure India has, where it's a very mixed public-private setup, there is very little data harmonization that happens across all the different health sectors. Only individual nursing homes, individual hospitals, not many of them don't use electronic medical records. And so even the public health surveillance system still using paper-based, reporting, which is often delayed. All of those things were amplified to sort of show that we need better systems. And India is not alone. I mean, India has the possibility of transforming the data systems it has because it has a lot of know-how and it has a sort of a lot of potential. But I think that still needs to be improved. So I would say that this is a really good wake-up call and an impetus to further transform India's data platforms for social good.
Going forward, what is the plan like on COVID data, on vaccine data? Are you going to do anything new?
Well, lots of things are planned in terms of continuing to amplify COVID analytics, including vaccination, who is and who isn't getting vaccinated, what are the reasons, looking at trends, really being able to very quickly in real time look at where do we need to be concerned as things change, day by day. I think we are using this platform now to inform many other diseases and conditions. So this will serve as a fantastic example of what can be done and what needs to be done. We're also using our own hospital system data in ways that we hadn't previously, because many of us have come together across the institution to mine our data to look at how people are accessing care. Can we do better with our care management of patients across all sorts of diseases? And can we predict better who needs what treatment, for example?
Since you're talking about prediction as a doctor, what would you think 2022 would bring really? Because 2021 was all about, so many waves of COVID and then vaccines, so many vaccines. Now you have booster dose, you have children's vaccines. So how do you look at 2022?
2022, I think, will be more of the same. I mean, I think COVID is never going to go away. Honestly, it's now, it may become something more like a flu where we'll have waves periodically, and some years will be better than others. I think it's become an endemic, or will become an endemic disease that we will face and will periodically be vaccinating. Let's hope that we don't need to create a new vaccine every year based on the sort of emergence of new variants. But I think 2022, what we'll hope to see is that we'll sort of understand what the new normal looks like. We'll have more of the world vaccinated. We still have many parts of the world, including much of Africa, still remains, the vast majority remain unvaccinated. So until we have most of the world, vaccinated, ideally 80% or more, or have been able to essentially quell it so that it is not emerging, having so many opportunities to be infecting so many people across the globe, then we will be in a better place. We're all tired of COVID. We want to go back to our lives as we know it. We want to be social. We want to be in meetings. We want to be gathering. We want to travel. We want to do all the things that we know and what make us human. But I think 2022, hopefully, will be better than 2021 in terms of the number of waves we've seen.
But you think there will be more waves in 2022?
I do, because I think we don't have still the numbers vaccinated that we need. And even when we've seen places like even in Europe right now, where 60% or more are vaccinated in certain countries, they're having some of the highest number of infections that they've ever seen. Again, it's become more of a pandemic of the unvaccinated, which are, is unfortunately, even with countries that have access to vaccine, we still have too many people that are hesitant to vaccination. We're only just beginning now to vaccinate children under the age of 12. So, we still have a ways to go.
What would your advice be to the governments around the world?
My advice to governments around the world is that we really do need to come together and do sort of short-term investments of making more vaccine available, and certainly long-term investments to create technology transfer and set up structures throughout the world so that countries are not dependent on just a few sources for medicines and vaccines. This isn't something we're going to solve entirely in this crisis, but we have to do both short and long-term investments to really improve the planet we live on. And that's not just for COVID. We're obviously also discussing things like climate change and other health issues that go across borders.
So finally, do you think it will be vaccines or medicines for COVID that will save the humanity?
I think vaccines, still, for every person vaccinated, you can do a better job of preventing infection than waiting till you have to treat it. I think, again, it's a combination. So people who do end up in the hospital or have been recently exposed will benefit. But, again, these medicines are still not widely available. We don't know how much they're going to cost, how accessible they'll be around the world. And I'm talking about the oral pills that have just recently received excitement and approval. But I think we still need to focus on vaccination. And then, of course, those people who do get sick and are able to get healthcare early can get the medicine, hopefully, right? We still have to see how well we do on that front. But vaccines always rule the day when we come to thinking about prevention of disease and reducing transmission.
Thank you so much for speaking to Business Standard. The key takeaway from the interview with Dr. Gupta was that COVID-19 may not go away and 2022 may be more of the same. But the good part is the future waves will only get milder.
If you like this video, share it and subscribe to Business Standard For more news, views, and insights, log on to www.business-standard.com. Do also follow us on YouTube, Twitter, Facebook, Instagram, Telegram, and LinkedIn.